Hello, my name is Lidia Guerrero. Today I am going to talk about effectiveness of form of physical therapy following total shoulder arthroplasty. Definition: the prosthesis from shoulder is an intervention surgical accepted in the present, but do not exist any revision published on the treatment. Physical therapeutic.
Just the years of firefighting and playing ball had just really taken a toll on it. It just continued to get worse and worse and worse.
Bill's shoulder caused him severe pain for several years.
The pain just never went away. It was there 24/7. It actually went up into my neck. I had a lot of headaches. I didn't sleep well at night. A lot of times 2 to 3 hours of sleep. It was hard to lay on my back or on my shoulder or any of that, so I was up constantly.
Finally, Bill decided he had lived with the pain long enough. He made an appointment with orthopedic surgeon Dr. Randall Otto with Premier Care Orthopedics and Sports Medicine, a division of Signature Medical Group. Dr. Otto specializes in shoulder and elbow surgery.
He had an advanced arthritis of a shoulder. About 5% of patients who have advanced shoulder arthritis can also have a rotator cuff tear or deficiency, and he fell into that category.
Since he was battling both arthritis and a rotator cuff injury, Dr. Otto told Bill a regular total shoulder replacement would not solve the problem. Dr. Otto instead performed a reverse shoulder replacement.
A reverse shoulder replacement is a replacement for a joint that has an unstable joint, whether that from a bony deformity or from a soft tissue deformity such as a rotator cuff tear or dysfunction. It has a built-in constraint to it, which makes it unique and different from a primary total shoulder replacement.
The surgery, combined with Bill's rehabilitation exercises, successfully restored his shoulder movement and relieved him of any pain.
I'd went out and played catch with my son. I played golf, I think, a couple months later. Done a little bit of everything that I hadn't done in years, but it's amazing the amount of flexibility and stuff that I got back in it. If you consider the pain you were in for 15 years, you take 4 months out of your life to do things correctly and make sure that it heals correctly and everything else, I would say that it's well worth the investment.
Application in physical therapy space with the developing protective inverted from shoulder has as objective general get a shoulder functional for the lifetime daily, getting better the quality from lifetime of the patient, wiping legs and what provide the higher functionality possible for each. The should start the therapy physical pros and cons. Joints replacement is generally considered an effective treatment for the symptoms of joint destruction. The results depend, as in any joint replacement, on the 4 factors. Issue apply in Ecuador. Efficacy of hydrokinesotherapy as a UV treatment of the recovery patient with total male arthroplasty in the rehabilitation area hospital of the Ecuadorian Instituto Social Security.
I'm Dr. Phil Jacobs with the San Antonio Orthopedic Group. I'm here to talk to you today about shoulder replacement surgery. One of the more common questions I have is, when am I a candidate for having a shoulder replaced? I tell patients that if they've been diagnosed with arthritis of the shoulder, have failed conservative treatment to include injections, therapy, and they're having pain that limits their daily activities, that they may be a candidate for shoulder replacement surgery. Let's take a look at an x-ray here of a shoulder that's arthritic. This is a right shoulder We have the humerus here. Here's the humeral head or the ball, and here's the socket. We can see there's a very narrowed space here between the two, which shows that there's arthritis in that shoulder, and there's actually a little osteophyte or extra bone that's growing down here. If we look at a side view or a lateral view, we can see the humeral head once again in the socket, and there's supposed to be a nice clear space between here. We can see that there is no space here, so there's abnormal wear of that socket. This patient had limited daily activities, was having significant pain, and had failed conservative treatment. So we went ahead and did a shoulder replacement surgery. Here you can see we've put a stem that goes down inside of the bone, and we've replaced the ball, which was arthritic, with a smooth metal ball. And you can't see it, but there's actually a plastic socket here that the metal ball then articulates through the plastic socket. Here's a side view showing once again the metal ball pointing directly at the socket, and there's the plastic socket that you can't see, but there is one here. And I have a model that can show you exactly what we're talking about. So what we have is the humerus here, and we take the humeral head and we actually remove it, and we place the stem that goes down inside the bone and then replace that with a metal ball. We then have a plastic socket, which we resurface the socket, and once we've done the surgery, that metal ball now articulates with the plastic socket, and the patient has good pain relief. So for patients that have arthritis of the shoulder and have failed conservative treatment, I think total shoulder replacement can be a very good option. One of the things you need to know is that it is surgery and it's going to require some recovery time, usually about 3 months before people are back to their normal daily activities with no restrictions, but ultimately we can give them pain relief and long-term function. If you have any questions about shoulder replacement surgery, please don't hesitate to contact my office.
Conclusion. The objective of the present investigation is to determine its repercussion on the activities daily living of patient, improving the quality of movement, the control life of the patient.